everybody, I'm Kelly Lynch and I'm the owner of Turning Point Wellness, a private therapy practice in Connecticut, and I specialize in treating trauma in EMS professionals. So as you know by now, if you've seen the other videos that CAPE has posted on their page with my lovely mug, I have partnered with CAPE to bring you more information, knowledge, and education around trauma, what it is and what it can look like as it shows up in yourselves, partners, friends or family members or other loved ones, and things that you can do to work on managing that in ways that feel healthier or more functional for you. But one of the things that we also need to talk about in the context of trauma is the stuff that can happen around trauma. So that's what I wanted to discuss with you today. And the topic of the stuff that happens around trauma is burnout. So I'm sure, first off, that most of you have either heard somebody using this word as they're expressing frustration about something, or you've used this word yourselves. So here's the thing about burnout that's important to understand first. This is a term that's become trendy in our society over the last, say, like 2 to 5 years. And most people in average positions in our society today actually should never be using this word, because burnout is an extreme state of being. Burnout is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. As a public safety provider and as somebody working in EMS, you will be exposed to prolonged states of stress. It's appropriate for you to use the term burnout at times if you've been in the field for quite some time, and if you have not had a break, and if you're not using appropriate and healthy coping strategies. If you don't have a strong support system, burnout could absolutely develop, because then there isn't necessarily that relief valve to blow off steam with people that you love, trust, and feel safe with. So in EMS, in public safety in general, burnout is absolutely something that we can see, but in the average person in our society today who is not in public safety, if you hear them using the word, they are probably using it incorrectly or inappropriately. That being said, some signs and symptoms of what burnout actually is. And again, emphasizing that this is an extreme state of being. Burnout is something that takes people years to work up to, and there are stages and phases of the whole concept of burnout that people have to actually work up to before they truly hit the point of burnout. This is something emphasizing. I know I'm repeating myself here, but it takes years to work up to a true state of burnout. So physically, this could be something where you experience new onset medical issues, hypertension, GI issues, new onset migraines. Maybe you're not sleeping anymore, but you're not necessarily having nightmares, you're just not sleeping. Feeling like you're constantly restless or just can't settle down. Feeling like you can't control your mind anymore and that your mind is just all over the place all the time. These are all physical things that can manifest as a result of burnout. When we flip over to the emotional side of things, though, when it comes to burnout, here's the tricky part where sometimes it's hard to know the difference between burnout and trauma. Is it one or the other, or is it both? Oftentimes, burnout, the emotional state of burnout, can look identical to the emotional state of extreme trauma or post-traumatic stress injury. This presents in a few different ways. So the main way that this will present in most people is in that emotional roller coaster. Now, if you were able to watch the video that I created around post-traumatic stress injury and the signs and symptoms of it, one of the things that I talked about is emotional states of being. The people who are actually experiencing post-traumatic stress will go from being fine 1 minute to raging the next, or fine 1 minute to being in a panic attack the next, or sobbing in the next minute. When we're talking about emotional states of being in burnout, it can look exactly the same. I want to emphasize here that it's okay if you're not sure which is which, if this is something that you're experiencing. You don't have to be able to tell the difference between the two. All that really matters here is working on managing this and getting into a state of recovery. That's the most important thing. So then moving on to the mental signs and symptoms that can show up in states of burnout. And again, I know I'm being repetitive here, but it's that important. I want to emphasize this is an extreme state of being that takes years to actually work up to. So mental signs and symptoms in burnout could be like, these are the people that you hear talking about, I just want to check out of society. And they're not talking about wanting to hurt themselves or anybody else. They just want to go live in the woods like a hermit and just be left alone. They want to have no footprint and just virtually disappear off the grid. These are the folks who will be just sad or morose all the time, because they can't find the good in anything anymore. It's like the everything sucks and feels bad type of mentality or perspective. These are the people that no matter how hard you joke around with them or how hard you try, you just can't get them to laugh or smile. Burnout is heavy. This is a big load to carry. And again, like I said before, I know I'm being repetitive with it, but I'm repetitive on purpose to drive the point home that this is an extreme state of being that takes years to work up to. This is not something that you just wake up one day and all of a sudden feel. This is a slow burn over the course of years that's developed by repetitive experiences, not only of trauma, but feeling unsupported in different kinds of communities, at work, by management or by supervisors, and feeling like there's no way out. When it comes to burnout and recovery, I'm going to talk about that a lot in the next video that I'll create for you. But really, the thing to focus on here is, what are you doing to take good care of yourselves? So all this is, and that's, like I said, that's coming in the next video, so keep an eye out for that. But really, the thing, again, to emphasize with burnout is this is a slow burn. It's an extreme state of being. It's an extreme state of mental, emotional, and physical distress that is a result of prolonged stress. If you feel that you're experiencing burnout, it's absolutely appropriate, important, and necessary to ask for help to figure out a way out of that rabbit hole. You can start with just turning to your partner and saying, hey, I don't think I'm okay. I think I need to talk about this. And just start talking. Just start getting support. Oftentimes, when people start talking it out, just the sheer fact of blowing off steam is a perfect enough starting point that getting a little bit of stuff out creates enough space that you feel like you can breathe again. So turn to somebody that you trust and feel safe with and just start talking it out. That's a great place to begin. And as always, if you have any questions for me, or if you want more information from me, you can certainly reach out to me. My email is turningpointwellnessllc@gmail.com. You can find me on the internet at www.turningpointwellnessllc.com. You can also find me on Facebook and Instagram. On Instagram, I'm unapologetically.authentic. On Facebook, you can come follow my business page at Turning Point Wellness LLC, or reach out to me on my private page, on my personal page, which is just Kelly Lynch. As always, guys, stay safe, stay healthy, and I'll see you next time. Have a great day.